I think the role of a social worker in the independent sector, in my experience, is varied. I would say it's about really supporting people and working with people to maximise their life opportunities. So this could involve advocating for somebody, for example. This could include supporting somebody to get their voice heard.
Well, I manage all the new referrals to our team, so I'll meet with potential new clients and do holistic assessments of their needs, strengths, outcomes they want to achieve, and bring them onto the team. I allocate them to appropriate support workers. I manage the training, safeguarding, accidents and incidents. I manage all that sort of side of the team. I deliver training as well. That's another part of my role, which is relatively new. And I provide formal supervision to the 6 support workers that I line manage. I also informally supervise anyone else on the team. My manager even comes to me with sort of ethical dilemmas that he might have issues with.
Within my role, I go out and visit people and complete assessments. It's not the same, it's kind of a very similar sort of assessment, but I come from a different kind of angle, I think.
Meet people in the community who've got so many diverse different backgrounds and interests and issues within their lives, and to try and bring them all together. What I can do is focus on that person and discover within the community what is best for them.
Working within the independent sector, I really enjoy doing. It allows me to have a lot of client contact. It allows me to work with clients on an individual and group basis. It allows me to work with professionals of lots of different areas, such as health, for example, nurses, OTs, physiotherapists.
Generally, when I tell people I'm a social worker, they ask me why I'm not in statutory social work. Often people are surprised that I'm a social worker because they only think that you would work for the council if you were a social worker, and there doesn't seem to be much understanding that social workers do work in the independent sector and don't always work as a social worker with that job title.
I've been a qualified social worker for a long time, since 1988 actually, and I've always worked in the independent sector. It's just somewhere where my heart lies, and I think the best part of my job is that I can practice, particularly now, I practice as a social worker, certainly working with the newly qualified social workers, and also manage a service that is very, very dear to my heart. I absolutely relish working with people with mental health difficulties, and I have a lot of contact with service users still, and I think for me it's the perfect job in lots of ways.
It made me become involved because I think that it's a good idea that social workers are used as support workers because they can put client at ease straight away, whereas some support workers don't have the training that the social workers have, and I think that's very important.
We need social workers, you know, we need balanced social workers, we need social workers that can go out there and work holistically, and I think this is what this is all about.